today we want to talk about patient advocacy and how important it is. And I want you to introduce yourself, so if you'll give us your name and who you work for and what you do.
Absolutely. So my name is Kristen McCreight. I am a registered nurse. I have the honor of being the Director of Patient Experience and also the Director of Education at Texas Health Mansfield.
Okay, excellent. Now, have you always done this line of work?
I have been a nurse for a little over 13 years. So I raised kids first. So it's definitely not the first thing I did. And my role predominantly has been at the bedside. So I have been what's called a medical surgical nurse. So if you're not in ICU and you're not having a baby, you're probably in somewhere like my world. And so predominant is anywhere from a geriatric population all the way down to the young person who's got to have their shoulder scoped.
Okay. So on the topic of patient advocacy, we wanted to highlight this and really talk about, first of all, let's talk about what it is, and then we'll go deeper. So can you kind of give us a definition?
Absolutely. So first, I would love to say that I think all of healthcare should see itself as an advocate. I know that that's my title, is a patient advocate, but I believe that as a person who speaks the language of healthcare, that is our responsibility to help a person understand the healthcare journey and what their needs are. That's our area of expertise, and we need to make it understandable for the person who comes into our world, the healthcare world. So specifically as a patient advocate, I help to navigate things that people didn't understand. If there was a question about a decision, or sometimes it's because they're not happy with how things went, and maybe there's trying to shed some light on the reasons for things. Something as simple as, why is the hospital so cold? To why couldn't I have that test while I was in the emergency room? And just helping to really shed light.
So, all right, so let me ask you something, because now you're explaining the role of a patient advocate within a healthcare system. And let me ask you one thing in regards to that. So does every hospital have someone in that capacity?
I don't think so. I don't think by title. There is someone who should be able to help, but they may not share that exact role. And that's part of asking the right questions is, do you have this as a service? Is this a person who you have that can help me?
And so that's one side. Then the flip side is, let's say that that's not existent. The patient themselves being their own advocate. So what does that mean? I mean, how aware do we need to be, the regular person out there? How aware do we need to be?
It's huge.
Okay, talk to me about that.
It is so incredibly important that it's yourself, or it's definitely a family member. It's that person that you trust to be a second set of ears. Our brains can only absorb so much, and especially if we've got a little bit of a healthcare crisis going on, big or small, and we hear, and sometimes jargon gets used that we didn't really understand, and maybe we didn't even know we could stop and say, I didn't understand that. Please clarify. So first, patients should absolutely be safe to speak up. It's their body, it's their health, and ultimately then it also is their financial commitment. I also think having a family member that is willing to sit beside you and ask those questions, to take those notes, to make sure, because you can't retain it all in one sitting, and you go, wait a minute, I think so. Having that second set of ears, as well as a really good notebook, and going in with questions and knowledge, and knowing that you have the right to understand.
Isn't it also too just kind of like keeping track of all your medical history so that you understand the things that you have, the medications that you take, knowing when, like if you're adding something, because I just know from listening to other people talk where they've had experiences where a prescription was given for something that no one realized at the time. Oh, you have another issue, and guess what? That contradicts what you're taking over here. Or just different things like that. It's like it's a whole big jigsaw puzzle. And if somebody's not looking at the whole thing, who is?
Absolutely. And that whole picture the puzzle's a great analogy, because if something's missing, you don't see the whole picture. And that medication list, when you took it last, when your doses got changed, your healthcare history, it could be something that you've thought about, it was 30 years ago, and it's just not even in your mind anymore. But when it comes to that test or that procedure, that history is actually very important. So having kind of a medical journal with some notes, having that on your phone, having it ready to go, knowing, I mean, even myself, I can't keep up with it all. And I'm a nurse.
Who can?
Right. That's what I do for a living, and I still can't keep up with it all. So it's you definitely want to be an advocate. You want to protect your investment, which of course is your health.
So do you think that maybe the reason why it's so important today is because of that, how things have changed? Maybe maybe we're sicker. I don't know. There's something that has changed, because I think that I just don't remember it ever being such an issue as it is today. And I don't know if it's because we've got so many different puzzle pieces or doctors that we're involved with, or I don't know. I don't understand. Can you
It's a
shed
complicated
light?
world. And of course, I don't have the official answer, but what I have seen both as a nurse as well as just a human being is that one-stop shop that we remember from our grandparents' day.
Yes.
Where they went and saw one doctor who took everything. Oh, by the way, that doctor came to see them in the hospital. In those days, legally and regulatory and insurance-wise, those are not really the world we live in anymore. So the need for those specialists, those needs for consultations and insurance approvals for what we do makes it even more complicated, because people think, well, if I have insurance, then I should be able to. No, not necessarily. There's a lot of rules that are specific to that as well.
Well, even in some cases, referrals aren't necessary. And that's where you end up getting into some trouble as well.
Absolutely.
If there's no one paying attention to everything.
And you can go into this experience of it's almost like looking for a needle in a haystack, where you get sent from one thing to another thing to another thing. And that's time. And it really can make your crisis worse.
Yeah.
So you want to be able to have as close to the right solution, not that you know your medical diagnosis, but you want to say, okay, what's going to get me the most direct answer? And sometimes that's hard.
Yeah. Do you think that some of it is, I mean, for so long, it was kind of like if the doctor said, or if the attorney said, that it was like, law.
Yes,
and it had to be right. Do you think that some of that stops us from maybe asking the questions we should ask? Or?
I think generationally there is change in there, but especially for like my parents, they don't really think that, they think the doctors should just be able to give them that information, and they don't necessarily answer or ask the right questions. So there's that. And then, everybody's on the internet. And that's both a blessing, has its dark side, because we can find any of our signs and symptoms, on the internet, and then we've made a decision on, so and that sometimes works the exact opposite of what the doctor or the insurance or it says we need to do. So we have to bring that together. The right way is to ask clarifying questions, to feel safe speaking up and saying, I didn't understand that. And sometimes we have to be accountable as an advocate, because if they're too busy, and everybody's too busy, the world is too busy.
That's right.
but this is still my health, my body.
Right.
And I need to have it slow down, and I need to be understood. And that's tough sometimes. And as we're building a relationship with your healthcare team, whether that's your primary care doctor or your specialist, but also really being able to have a family advocate, someone that is your family and yourself looking out for, do I really understand what's happening?
Right. Are there specific tools for us to use? I mean, if you're in a scenario where there's not someone like you, are there tools or are there things guides that can help people that, these are things you need to be doing?
Yeah, I think that there are, I'll be honest, I don't know exactly if there's like a one great place to go. I do think that knowing your resources through your insurance, kind of how your insurance works, having a great med list is really, really important. Knowing exactly what you have and when you took it last, and having multiple copies, because it tends to get lost. It doesn't come back to you. I think that doing research ahead of time is good, but then being able to stop and say, okay, now I need to ask some questions. And then if I don't understand, who's going to be my next contact? And saying, if the doctor says, well, we'll just call back and ask, tell me more about that. Because people now have patient portal. They can message a question. And so, what's the best way to get my questions answered? I don't know that there is a one good solution. I think it depends kind of on what your insurance process. If you have a great relationship with your doctor, that's huge. Yeah, that's huge.
Yeah, especially if you've got, that's the importance of having that MD, that your general practitioner.
That PCP, is definitely a good part of the relationship, and having somebody that really does have a handle on the big picture. But I also think if you do find that call me, because I want to know what that tool is, or if we can make that tool, then we can retire and do the world a great service. But I think that the body is so complicated. It's a mysterious thing. And, like bone pain. Okay, well, is it from the nerves? Is it from the back? Is it, everything is so intertwined. And so I don't know that there is a one-stop, easy to find resource. Yeah. But knowing your questions.
Maybe it's an attitude of permission to ask.
I think that's wise. Yeah. I think it's spirit of inquiry. Yeah. And the willingness to ask. Push. Yes. And we have to be, there's a lot of times healthcare makes a decision because maybe that person's really loud. Well, maybe they can't hear, or maybe they're scared. And so it's not personal that they're anxious. Right. And so part is we have to come to a mutual respect, dignity for each other. And what can I do to help is really the way we should look at it.
Okay, so number one, look for somebody like you within the system. Are there patient advocates, and ask for that. And if not, then be prepared to be your own.
And bring somebody with you. Have your notes out ready to go. And again, as much information when your brain is overwhelmed for whatever reason. And usually, if they're in the hospital, they're in crisis of some kind, and they need to have a list that's already ready to go, that has some basic medical history and their meds, and you have a folder with multiple copies. Go old school, and just hand it, because even going from your pharmacy to your insurance to your doctors, things we don't want to say that things get lost in this world, but
they do.
But they do.
We're human.
Yes. And even though we've got more technology than ever, you cannot replace the human factor. Right. And just a good verbal conversation of us hearing each other is majorly important. Can't take that out of the equation.
Okay. All right. Thank you. I appreciate it very much.
Absolutely. And we want to help. That's what we're here for, is us humans working together.
Okay.
Thank you.